Good morning to all of you. So today we are going to study a new topic, that is transposition of great arteries, TGA. This is also called as transposition of great vessels. Now we'll study what it is. Now what does it mean? Transposition means in each other's place. Now because we are talking about transposition of great arteries, we have two great arteries. First is pulmonary artery, which normally carries blue, that is deoxygenated blood from the right ventricle into the lungs, and the aorta, which carries red, that is oxygenated blood from the left ventricle to the body. This is normal things. Okay. Now we have not yet studied what is the meaning of transposition. Transposition is in each other's place. एक जो चीज जहां था वहां से एक दूसरे से एक्सचेंज हो गया है, दैट इज ट्रांसपोजिशन. नाउ क्या एक्सचेंज हुआ है? वी हैव टू ग्रेट आर्टरीज. वन इज पल्मोनरी आर्टरी. We know that pulmonary artery carries deoxygenated blood from the right ventricle, and aorta carries oxygenated blood from the left ventricle, and aorta is the only source of oxygenated blood to all parts of the body. Now see, this is the normal healthy heart. We know that this is the left atrium, left ventricle, right atrium, right ventricle. Pulmonary artery arises from the right ventricle, goes into divides into two and goes to both the lungs, and aorta arises from the left ventricle. Then there's arch of aorta, then continues down as the abdominal aorta, and we have the coronary arteries arising as first branch of the aorta. So this is normal. Coronary arteries are not depicted here. So this is normal heart. So here it is transposition of great vessels. So what you have here, here is, see, this is aorta. It is arising from the right ventricle, and pulmonary artery is arising from the left ventricle. ये समझ में आ गया? So this exchange has taken place. Starting point is now exchanged. See, here it was starting from here. Now this arch of aorta, see, this is arch of aorta, and it is arising from the right ventricle, and pulmonary artery is arising from the left ventricle. Now the hallmark of transposition of great arteries is ventriculo-arterial discordance, that is, in which the aorta arises from the morphological right ventricle, and pulmonary artery arises from the morphologic left ventricle. Morphologic means it is now this is what we find in the structural issues. Okay, so this is the basic issue. The starting point is now defective. Aorta is arising from right ventricle instead of left, and pulmonary artery is arising from the left ventricle instead of right. So this was described over 2 centuries ago. That is 200 years ago, people knew about this transposition of great vessel. But no treatment is available until the middle of 20th century. Okay. Now, the anatomical configuration of this anomaly establishes a potentially fatal parallel circulation that results in deep hypoxemia from the lack of mixing, which results lactic acidosis and demise. Prompt adequate preoperative intervention and stabilization, followed by surgical repair, and expert postoperative management favor an excellent outcome. So this is the basic issue. So what happens here is, there is uh, the anatomical configuration is here is, we know that aorta carries oxygenated blood, but because the starting point is defective, because it is arising from the right ventricle, so it circulates deoxygenated blood to all parts of the body. Pulmonary artery should have taken deoxygenated blood, but now it is taken oxygenated blood, which has come from the lungs into the left atrium, into the left ventricle. That same blood is going back to the lungs. Okay, so this results in deep hypoxemia. Okay, and if there is no mixing means if there is no associated defects. What can be the associated defects? If there is no ASD, we know that what is ASD? A hole between right atrium and right ventricle. If there is no VSD, if there is no hole between the right ventricle and the left ventricle, if the ductus arteriosus is not patent. So these are the three things where you can have mixing. But if there is no mixing, if there is no mixing at all, then what happens is any condition in which there is lack of oxygenation, this results in lactic acidosis. Okay, this results in lactic acidosis, and it can lead to demise, means death of the child. Okay, so here is there is the fatal parallel circulation. This is the parallel circulation. Oxygenated blood is going back to the lungs for reoxygenation, which is of no use. Deoxygenated blood is going to all parts of the body, again, which is of no use. So the none of the cells are getting the oxygenated blood supply, which has to be there. And if there is लैक ऑफ ऑक्सीजन, जब भी लैक ऑफ ऑक्सीजन रहता है, द इश्यू इज अगर मिक्सिंग नहीं है, मिक्सिंग कैसे हो सकता है, एएसडी अगर है, मींस ट्रांसपोजिशन ऑफ ग्रेट वेसल के साथ में, इफ एएसडी इज देयर, व्हाट इज एएसडी, होल बिटवीन राइट एट्रियम राइट वेंट्रिकल. बीएसडी है, इफ देयर इज अ होल बिटवीन right ventricle and the left ventricle, and if there is patent ductus arteriosus. अगर मिक्सिंग नहीं है तो क्या होगा, देयर विल बी लैक्टिक एसिडोसिस. जब भी ऑक्सीजन का सप्लाई कम होता है, कैन बी दिस, कैन बी शॉक, कभी भी इन एनी सिचुएशन, whenever there is a lack of oxygen supply, the result is there is always lactic acidosis. Okay, so there is lactic acidosis, and it can even lead to death of the child. So prompt adequate preoperative intervention. Prompt means we need to identify that this might be the issue, some investigation has to be done, and if there is no mixing, then prompt prompt care, adequate preoperative intervention and stabilization, followed by surgical repair. So because we have studied different congenital heart disease, we have already we know that if we want to keep the ductus open, then what we need to do is we give prostaglandin E1. And suppose if you diagnose such a case, then what we need to do is we need to start prostaglandin E1, so that the ductus remains open. At least that can be done, followed by surgical repair and expert post-operative management. This occurs a excellent outcome. Okay, so this is normal heart. Again, this is a better picture. Okay, so here is the aorta is arising from the left ventricle. Pulmonary artery is arising from the right ventricle, but here you can see aorta is arising, and this is having a blue tinged color. Okay, so in approximately 60% of the patients, aorta is anterior. Anterior मतलब सामने की तरफ है, and to the right of pulmonary artery. Pulmonary artery के right side में. Okay, so this is called as dextro transposition of the great artery. It is also called as TGA, DTGA. And in some patients, what happens is, in however subset of patients, the aorta may be anterior to the left of pulmonary artery. So this is called as levotransposition of great vessel, LTGA. Okay, so depending on the position of the aorta, ठीक है, aorta का position दोनों में anterior मतलब aorta सामने की तरफ है, अब pulmonary artery के right की तरफ है, so that is called as dextrotransposition. अगर लेफ्ट की तरफ है, पल्मोनरी आर्टरी के लेफ्ट की तरफ है, then it is called as levotransposition of the great vessels. So in approximately 1/3 of the patients with transposition of the great vessels, coronary artery anatomy is abnormal. What is coronary artery? It is the first branch of aorta, और aorta से निकलने का first branch, right branch, left branch, फिर उसके further branching है. This gives oxygenated supply to the myocardium and other layers of the heart. This supplies to the layers of the heart, coronary artery. Now 1/3 of the patients will have coronary, there will be abnormal anatomy of the coronary artery. Okay, so what we have studied here, we have studied here two types of the transposition of the great artery in relation to position of the aorta. If the aorta is to the right of pulmonary artery, it is called as dextrotransposition. If it is to the left of the pulmonary artery, it is called as levotransposition. And 1/3 of the patients will have the coronary artery, abnormal coronary artery anatomy. Okay. Now, this is the most common cause of cyanosis. Can you see the cyanosis here? See, this is the cyanosis. Can you see the cyanosis? Can you see the cyanosis? Okay. So, these are all is the most common cyanosis. This TGA occurs in 5 to 7% of all congenital heart disease, 20 to 30 per 1 lakh live births, 20 to 30 incidences per 1 lakh live births, and more in male as compared to female, that is 60 to 70% in male child. So this is central cyanosis. So what is a pathophysiology? Transposition of great artery, aorta rises from the right ventricle, deoxygenated blood circulates to all parts of the body, cyanosis. Pulmonary artery arises from left ventricle, oxygenated blood goes back to the lungs. Okay, so this is the basic pathophysiology. Now, 3 common anatomic site for mixing of oxygenated deoxygenated blood to allow the life to be sustained as patent foramen ovale or atrial septal level. We want foramen ovale that is not closed, and or there can be AST or VST, or can be a patent foramen ovale also. What is foramen ovale? If you remember the fetal circulation, it is a opening between right atrium and the left atrium, which is a normal for fetal circulation. So sometimes there can be foramen ovale which normally closes soon after birth, but if it does not close, then it is patent foramen ovale, or it can be AST. Now, what are the maternal risk factors? Age is over 40 years of age. For example, somebody is becoming pregnant after 40 years. So, there are chances of transposition of great vessel. If the mother is having diabetes, rubella during pregnancy is very dangerous for cardiac defects if the maternal nutrition is not so good, or if the mother is in a habit of taking alcohol. So these are the maternal risk factors, that if these factors are there, there are chances that the child which is born of such a pregnant mother may have transposition of the great vessels. Now, cyanosis appears in first 24 hours if there is no mixing at the atrial level. Mild cyanosis, particularly while crying, may be evident. So this may be there. Mild cyanosis while crying might be evident. Then signs of congestive heart failure. What are the signs of congestive heart failure? Tachypnea, tachycardia, diaphoresis, and failure to gain weight may become evident over first 3 to 6 weeks as pulmonary blood flow increases if large VST is present. I was talking that many a times this transposition of great vessels may be associated with congenital heart defect. Suppose if there is a large VST, okay, if there is a large VST, so if there is large VST, there is mixing of blood, and what happens is this may lead to congestive heart failure. Okay, so how to know if congestive heart failure is there? At the age of first 3 to 6 weeks. If you remember our previous classes, we know that there is weight loss in first 7 to 10 days of life. After that, the child gain weights very fast. Okay, but if you take the first 3 to 6 weeks, so that is till 1.5 months, you will find that there can be tachypnea, that is respiratory rate will be more, tachycardia, the heart rate will be more, the child will be sweating, and the child will not be gaining weight. Okay, this usually occurs if there is a large VST presence and there are signs of excessive pulmonary blood flow. Now, abnormal heart sounds can be there: prominent right ventricular heave, single second heart sound, loud A2, systolic murmur if VSD is present. This all depends on different sounds are available. Can be heard by using a stethoscope. If depending on the associated heart defects also. So abnormal heart sounds or murmurs can be heard. Then if you see the pulse oximetry, this is the photograph of it. Pulse oximetry shows cyanosis and there can be discrepancy between upper and lower limbs. Discrepancy matlab difference between upper limbs and lower limbs. So by the time this deoxygenated blood is coming down, more of cyanosis will be there. Okay, so that there can be discrepancies between upper and lower limbs. And if you take a ABG, that is arterial blood gas analysis, that findings will show metabolic acidosis because of the lactic acetate generation with decreased PaO2, and there is lack of oxygen going to distal organs, cell respire anaerobically producing lactate. Okay, so whenever there is less of oxygen supply, there is lactate is produced by the cells because there is anaerobic respiration. Anaerobic means without oxygen supply. Now, what are the investigation? Echocardiogram, the best diagnosis for this. So this shows the findings, that is aorta rising from the right side and pulmonary artery rising from the left side. If you take a chest X-ray, this is like an egg on a string. Okay, this is how it looks. So due to potentially narrowed upper mediastinum, cardiomegaly and increased pulmonary vascular markings. So because of the changes which are taking place here, it looks as if there is an egg on a string appearance. Okay, so this is the finding in chest X-ray. Now, initial management, I was talking earlier also, we need to give prostaglandin even infusion because we want to keep the adductors patent, because this allows for mixing of blood, or there can be emergency atrial balloon septostomy to allow for mixing. Or can you see this diagram? We are using a balloon catheter and we are creating a ASD here. Okay, we are creating a ASD here. So this is emergency atrial balloon septostomy to allow for mixing, and we need to correct metabolic acidosis. Okay, metabolic acidosis needs to be corrected. Now, long-term management is, even if you do a septostomy, create ASD, okay, which we studied in the previous slide. इमरजेंसी में आप क्या कर रहे हैं? एट्रियल बैलून सेप्टोस्टोमी करके यहाँ पर एक होल क्रिएट कर रहे हैं between the right atrium and left atrium to allow for mixing. Okay, but this solution, keeping the ductus arteriosus open, correcting the metabolic acidosis, is not the final solution. Why? Because these are all symptomatic management. अच्छा ऑक्सीजन नहीं मिल रहा है तो चलो थोड़ा रास्ता खोल दें. So these are all different steps. अच्छा acidosis हो रहा है, you correct that acid. So these are all symptomatic management, but your basic problem is not solved. So for that, the surgical management is the only way out. So that surgery is called as arterial switch operation, ASO, arterial switch operation. And this is performed before the age of 4 weeks. That is, before the child is of 1 month, this arterial switch operation is done. Okay, so long-term follow-up and counseling in future female patients wish to get pregnant. So if the follow-up is not only concentrated on the immediate post-operative period, but this continues throughout the life also. Okay, so long-term follow-up is required. So this is arterial switch. Can you see this? So these are incision lines. This is pulmonary artery. So these are coronary arteries. Okay, so what we need to do is we just switch it. Okay, जहाँ से aorta start हो रहा था वहाँ से उसको exchange कर रहे हैं. So this is called as arterial switch. Now, what are the complications? Prognosis depends on the complexity of TGA, how it was surgically repaired. Okay, so this all depends on TGA के साथ कुछ और congenital defects था क्या, कुछ problem और था क्या, depending on that, all this depends. Post surgical correction survival is approximately greater than 90% in 20 years. मतलब 90% of the people they live beyond 20 years of age. Long term consequences में है neopulmonary stenosis and neo-aortic regurgitation. क्या मतलब है? Neo मतलब new. Pulmonary stenosis हम लोग पहले भी पढ़े हैं. That is, there is narrowing of the pulmonary artery. So because of this operation, what happens is the pulmonary artery gets narrowed. फिर ब्लड सप्लाई टू द लंग्स गेट अफेक्टेड. दूसरा प्रॉब्लम क्या है? नियो आयोटिक रिगर्जिटेशन. नियो आयोटिक रिगर्जिटेशन का मतलब है कि आयोटिक वाल्व ठीक से काम नहीं कर रहा है. जो ब्लड aorta में जा रहा है, कुछ ब्लड वापस आ रहा है. सो दैट इज कॉल्ड एज नियो आर्टिक रिगर्जिटेशन. ओके, सो नियो पल्मोनरी नियो आर्टिक मीन्स दीज प्रॉब्लम्स वर नॉट देयर, पर ये कब हो रहा है? ऑपरेशन के बाद. सो दिस कैन बी द लॉन्ग टर्म consequences. So there can be problems of coronary artery disease also, and 2 to 8% of the patients may require intervention. एंजियोप्लास्टी का जरूरत पड़ सकता है, स्टेंट डालने का जरूरत पड़ सकता है, सर्जिकल पैच आर्टेरियोप्लास्टी. सो दीज आर द डिफरेंट. If complications are there, these interventions are required, but these are required only for 2 to 8% of patients. Okay. Then there can be obstructed coronary arteries. हम लोग पढ़े थे कि that if you have transposition of great vessels, 1/3 of the patients will have abnormalities in coronary arteries. What are coronary arteries? The first branch that arises from aorta, and this supplies the blood to the heart muscles. Okay, so obstructed coronary arteries 5 to 7%, and this can be the most common problems of morbidity and mortality, and the incidences of myocardial ischemia, infarction and death is highest in first 3 months after ASO. Okay, so see, the issue here is, देखो अभी आयोटा और पल्मोनरी आर्टरी शिफ्ट हो गया था ना, उसको आपने रिपेयर कर दिया. कोरोनरी आर्टरी ऑब्स्ट्रक्ट हो गया, तो द इश्यू इज हार्ट मसल में ही ब्लड सप्लाई नहीं मिलेगा. ओके, सो इफ द हार्ट मसल्स आर नॉट गेटिंग द ब्लड सप्लाई, दे विल नॉट बी एबल टू पंप. If the heart is not able to pump, the blood will not be able to go to the lungs, neither to all parts of the body. Okay, so then the blood which is coming back from the lungs will not be able to come properly. The blood will not be able to empty in the right and the left atrium. ये सारा प्रॉब्लम स्टार्ट हो जाएगा अगर मसल को सप्लाई नहीं मिल रहा है. ओके, सो 5 to 7% ऑफ द पेशेंट्स में these are the problem, and this can be this causes myocardial ischemia, infarction and death, and this occurs in first 3 months after. So that is arterial switch operation. Okay, so आपको चेक करते रहना पड़ेगा. Then incidences of sudden cardiac death in repair TGA patients are reported 0.32 to 0.8%. Okay, so some arrhythmia can be there, and there can be sudden cardiac death also. Okay. Now, another problem here is neurodevelopment abnormalities. Okay, so there is high frequency of neurodevelopmental abnormalities. Okay, so neurodevelopment abnormalities check करना है, and the issue is there is if the low gestational age, suppose if the baby is preterm and if the lactate level before operation is high. So this leads to poor developmental outcome. So that was all about the transposition of great vessels. I hope you have understood the topic. Thank you for your patient listening.